Dr. Anita Parker here, helping you get even better with your chiropractic adjustments. So one of the things that I've been working on a lot, almost with every adjustment, are wrists. I'm sure you probably have been noticing a lot of your patients complaining of wrist pain, carpal tunnel type of issues, thumb pain because of our device use. It's inevitable, which is why this video today is I'm gonna just show you some of the ways to make it more comfortable and give you more ease on this adjustment and more success for your patients. So as I start with the wrist over here, the way that I like to palpate the wrist sets the tone, in my opinion, for the patient to be able to relax. So as I'm kind of taking her wrist over here, I'm just going through her carpals with my thenar pads, and I'm checking each section of the carpals for motion or lack of. So on my little model here, obviously with the carpal bones on here, I'm using my thenars just like this to go in between each joint. So I'm checking to see, are these moving? Are these getting some, in my palpation? So my thenars are going in between them to see on each side. And if something's stuck, you'll feel it. So as I do that, Doc, I'm coming back right over here. And when I find the subluxation, and I do right here, she's got a little bit right here on the kind of the scaphoid, like up in the top here where the thumb is, right? And that's a big common area with the phones these days. So in order for me to adjust it, I feel that it's popped anteriorly this way. So it's kind of going up on this side, or it's pushed down this way. So the way that I'm going to adjust it, I'm going to use my thenars. I'm going to take my fingers and I'm cupping that bone, that specific bone. Then all I'm doing to get the adjustment in, so I've kind of kept this hand, my fingers are like this on the opposite side. The bone I'm adjusting is this carpal right there. So my finger is on it, okay? And my thenar on the opposite side. And the way you want to adjust is kind of giving that little bit of traction. So I'm kind of extending her palm or her wrist, extending it upwards. And at the same time, you're just gonna go pushing it in, okay? So it's kind of a quick jolt. The first time I did it, it didn't move. So I went a couple of extra times, as you felt, to really get it in. And then I like to double check. Oh yeah, it's moving now. It may not pop, but it still will move oftentimes. You want to just double check that. So now I'm just gonna go across the rest of the wrist to see if there's anything else. A little bit right in the midline here. So again, same technique. I'm using my thenar pad so it's more comfortable for the patient to relax. I'm kind of distracting a little bit by pulling my body away, and then I just push down. If you feel that this is difficult to get this area to relax, another idea would be to have your patient sit up. So go ahead and have a seat. And sometimes going in this angle can help you to get the patient to relax. Having their elbow relax can also help that adjustment to go. And sometimes if you still can't get it even in this angle, have your patient stand, just in case. The third option. And same thing, I'm gonna use my thenars, but just the fact that she's higher up, the traction's already done for me because I'm seated here. If it's still like, if you feel like you're taller than the patient, you can even kind of crouch down and then get in there. Let me show on this side too, with the standing and seated version, okay? So she's standing, I'll kind of get in there, I'm palpating, checking. This one's not too bad. But if I wanted to kind of get right in there, so I would face the patient like this, and then just snap it right out. One thing to note, docs, is when you're adjusting wrists, it's always good to double check the elbow joint because that will affect the wrist. And I can share that with you on a future video. Hope this helped. I'll be back again soon with another tip.